Hello, my name's Sarah, and I'm going to be your occupational therapist for today. I understand that you are suffering from a neurocognitive disorder due to a traumatic brain injury. So, I'm here to work with you on getting started on a medication management plan to get you taking your medication on a daily basis and making it a little bit easier for you to remember when and what's the best time to take your medication so that you don't forget. So the first medication that I see you're taking is phenytoin, which some of the side effects of that may be a headache, nausea, vomiting, constipation, dizziness, feeling of spinning, drowsiness, trouble sleeping, maybe some nervousness, and I see that it may cause some swelling or bleeding in the gums, which is just another side effect of the medication. Another medication that I see are taking are methylphenidate, which helps with your alertness and really using that cognitive function. Some of the side effects of that may be nervousness, trouble sleeping, loss of appetite, weight loss, dizziness, nausea, vomiting, or headache, and you may see a little rise in blood pressure with that medication. Some precautions you may want to consider are limiting your intake of alcoholic beverages while on medication. It could affect your blood levels, and if you're diabetic, you want to be sure to monitor your blood glucose levels because the medication may increase your blood sugar. And if you're pregnant, only use this medication when needed, and you must consult the doctor before breastfeeding because this medication does pass through the breast milk. And if you are taking methylphenidate for a long time, the drug is possible to affect the child's growth weight and the final adult height of the child. So be sure to speak with your doctor about this medication if you are pregnant. And also consult with your doctor if you have any history of high blood pressure, blood circulation problems, glaucoma, heart problems, family history of heart problems, mental or mood conditions, personal or family history of mental or mood disorders, personal or family history of uncontrolled muscle movements, an overactive thyroid, or seizure disorder. So let's get started on what this medication management plan is going to entail. First, I think it would be beneficial to you to go ahead and write out your daily schedule, starting on Sunday and going all the way to the end of the week on Saturday. And you want to make sure to include all roles, including your spouse, your parents, your children, anything that takes part in your day, even if it's just making your lunch for your spouse or picking up your children from school, or even your parents if you take care of your parents. That's something that you want to write down in your schedule. And any routines such as going to work, when you wake up, your habits such as showering and brushing your hair and brushing your teeth, and just all daily routines you want to include in this schedule. And then we can sit down and look at this schedule and figure out the best time for you to incorporate taking your medication, and write that down on your schedule so that you have that written in stone and you know when you need to take your medication and what is the easiest time for you to remember to do that. And if you struggle with remembering, you can get out your cell phone and set an alarm for every day of the week. You can have it on repeat, and it will alarm you when to take your medication so that one day, let's say you may be really busy, it might slip your mind and you forget, and your alarm goes off and you say, oh, okay, I need to go take my medication now. So an alarm, I think, would be very helpful to you. And then also, I think part of this plan should be making a medication log so that you can look back and see that you are consistently taking your medicine and you know what time and what day of the week that you're taking this medicine, so that you can maintain this consistency throughout your life. So I think the medication log should look something like this. Start on Sunday, go all the way through Saturday, and let's say you take your medication on 10-27 at 8 a.m. Just write that down right under Sunday, and then go all the way through the week. And I think this will be a good way for you to remember if you've taken your medication, if you, let's say you turned off your alarm and you say, oh, I'll go do that in 10 minutes. Well, 2 hours goes by and you may have forgotten. So you can just check your log and see if you had taken it or not. And that way you know for sure if you have or not. And it's not just something that you have sitting in your mind and you have it written down for you to look back on. So as your OT, I want to be sure that you are incorporating all of these roles, habits, routines into your schedule and making it easier for you to remember to take that medication, because that's what's going to get you better and keep you functioning in your daily schedule. An alternative option that might be helpful as well is a pill box. They have them at local drugstores that are labeled from Sunday to Saturday for the entire week, and we could sit down and I can show you how to plan out your medication for the week. And then once you are able to understand how to do that on your own, you can pick a day of the week where you have some free time, and every week on that day you can set aside some time to put your medication for that week into your pill box, so that way you're not taking the extra time to do that every single day, and it's already there sitting for you, and all you have to do is open up the pill box and take your medicine and then log it in your log. And then let's say you have an emergency. For example, a hurricane comes in and you have to evacuate. You need to have a plan, because let's say you have 1 week left of your medication and you're out of town for 2 weeks. That means you're 1 week without medication. So for your emergency plan, I would like for you to have a list of all emergency contact numbers, including your spouse, your parents, children, close family members, and your doctors, and have this written down in case of an emergency. And then I think it would be beneficial for you to make an appointment with your doctor so that you can get an extra prescription script and get that filled immediately, so that you can have that on hand in case of an emergency. And if you were to run out of medication, let's say you forgot one day even to go pick up your meds for that week, you have that extra one sitting at home so that you don't have a day where you're going without taking your medication. And you should take both these emergency contact numbers and the extra script and put them in a safe place that you're going to remember where they're at, and it's easily accessible for you to get to in case an emergency were to ever happen.